This video is for educational and informational purposes only. The content is based on personal experiences and is not medical advice. Always consult a qualified healthcare professional for personalized medical guidance.
They say cancer is a genetic disease. It's a very complicated disease. That's bullshit. I have the science. I publish these papers in top medical journals. If people want to live, they'll know about it.
Professor Thomas Seyfried is a world-renowned expert in cancer and a best-selling author of Cancer as a Metabolic Disease.
He has a revolutionary treatment for cancer that even your doctor doesn't know.
We have 1,700 people a day dying in the United States from cancer, and we have people dying from cancer in all countries around the world. Yeah, you can have cancer, but if you know how to manage it, it doesn't become a death sentence. Yeah, well, we had Pablo Kelly.
My name is Pablo Kelly, and when I was about 24, I was diagnosed with a grade 4 glioblastoma multiform brain tumor. I was given 6 to 9 months talking to the oncologist. I declined standard of care.
With 2.5 years of metabolic therapy, voila, the tumor was operable. And the same thing can be with breast cancer, prostate cancer, colon cancer. They all can be managed quite effectively with metabolic therapy. The high-fat diet is designed to keep your mitochondria healthy. If your mitochondria remain healthy, you're not going to get cancer. It's not like, oh, let me go out and eat a tub of lard. Let the GKI, the glucose-ketone index, tell you what you can and cannot eat. And we know we kill cancer cells when we have a GKI 2.0 and below. Wait till the world knows about this. Everybody's going to be jumping on metabolic therapy. Where are you going? I think the exercise comes in as a real issue here. I think if you're actively exercising regularly, they call it an opportunity to exercise, a half an hour for an hour a day in a cardiovascular exercise, significantly reduces the risk from eating the bread and the butter, or other potentially harmful foods. Everything is in balance. But we're a species that are absolutely imbalanced. We're compulsive, right? Everybody's compulsive with one thing or another. They binge eat, and then they don't eat. It's like they binge drink and then they don't drink. So it's a balance thing. But we're not telling anybody they can't binge eat or binge drink or whatever, as long as they can maintain a generally good exercise and a GKI that's not too whacked out. We see GKIs, 50 and above. Sometimes we see really high GKIs, whereas you're like a diabetic with, 300 milligram per deciliter with almost no ketones. I mean, his GKI is like 800, something like this. So we'll do the calculation. I'd have to sit here and do the calculation. You have to convert the glucose to millimolar, and you divide it by 18. So you'd have to divide 300 by 18, and then let me see. So you'd have 300. That would be 300 milligram per deciliter, which is pretty high. That's like a diabetic, right? Divided by 1.8 equals. So that's 16 by 6. That's what is 16 millimolar. Divided by 0.01. Okay, that gives you a GKI of 1,600 GKI. And to kill cancer cells, you need 2.0 below. So you can get an idea of how whacked out your GKI can be in these very unhealthy states. So we're saying anything above 50 it becomes on a regular basis, not on occasional. Because if we're in a healthy zone and we're going to go out and eat the big cheesecake with chocolate syrup on it, or a deep fried Twinkie with powdered sugar on it, you're going to spike your GKI, but it's only going to be there for a short period of time before you can level back down. But the poor diabetic who has 300 milligram per deciliter with zero ketones in his body, his GKI is going to be really, really high, very unhealthy. And then you see, he has what else does he have behind diabetes? Oh, he's morbidly obese. Oh, he's got high blood pressure. Oh, well, of course, you're putting it all together now. And then you say, well, look at what's my GKI? Well, it's like 500 or 600. Well, that tells you why you're in that zone. You shouldn't be in that zone. So what the GKI is a hard quantitative measure to allow a person in any culture, any religion, any gender, to know whether or not they choose to stay in an unhealthy zone or choose to enter into these healthy zones. And then they can personally determine how long they want to maintain these zones. But the issue is they don't, right now, there is no quantitative biomarker tool that can do that except the glucose-ketone index. And that's going to be the tool that people in the world will use to determine whether or not they're in various kinds of zones of health or zones that will put them at risk for chronic disease and cancer. Yeah, so it's just the ratio of blood sugar to ketones. The problem is the meters read sugar in milligrams per deciliter, and that has to be converted to millimolar. So the Mojo does it all for you. You have a little strip of, now here's the situation. Right now you have to take a drop of blood from the tip of your finger, and you get, okay, that gives you the glucose. You put it in the meter, it reads the glucose. Then you squeeze your finger a little bit more, take a ketone strip and touch your drop, and then put that into the meter, and then it will give you the ketones. And then you push the button on the meter, and it gives you the ratio, which is the GKI. So you know right away. But you see, our technology is advancing rather rapidly. And we have a free Libra blood glucose constant monitor that you can put on your arm. Once the monitor comes out that you can measure both glucose and ketones, and it will do all the conversions for you, then you can go on your cell phone, and at any given time, you're going to see your GKI while you're eating the donut, while you're eating the pizza, or while you're eating the kangaroo. Well, that throws you down. That brings your GKI down much further. So this is one of the strategies that we just published in our big cancer treatment protocol with many authors, physicians, scientists, nutrition, dietitians, and the whole group that understand the concepts. Because a lot of people cannot go cold turkey with water-only fasting. It is very hard. You're addicted to glucose. It's like, how easy is it, if you're an alcoholic, how easy is it to all of a sudden go cold turkey on the drink? Not easy. If you're a heavy smoker, how easy is it to stop smoking? Not easy. If you're a drug addict, you're hooked on heroin or cocaine, you can't wake up and say, I don't want it today. You're addicted. And glucose is a powerful addiction to the brain. You don't believe me? Okay, don't eat now for the next 3 days, and you'll see how powerful that glucose addiction is. So one way to break that is to just go for a week or 10 days on a very low carbohydrate diet, and you can down lower the carbohydrates as you go through, because you'll even eating a very low carbohydrate diet with whether it's carnivore or whatever, a pescatarian, Mediterranean, a very low carb, your body will slowly adjust because we're moving back into our Paleolithic zone as we evolve. This is who we are. We're Paleolithic people. And then when you're down and you say, my GKI is like, wow, it's 5. It's really doing good. Now I want to kill cancer cells and I need to get 2.0 or below. Then you do water-only fasting and you jump into water-only fasting. And now the body has already acclimated itself to approach this special zone. Then when you're in water-only fasting, your GKI will get below 2, sometimes below 1. Then you come in with the parasite medications and some other these touching glutamine targeting drugs, and you just blast the hell out of these tumor cells. Man, they get cold cocked because they can't handle this. This is not the environment that makes them happy, that keeps them growing. You're actually strangling and starving them to death. But the rest of the body is getting healthy, burning the ketones and fatty acids. It's just we evolved to burn ketones and fatty acids. The brain can switch from glucose to not fatty acids. The brain switches to ketones. But the muscles can burn fatty acids. The heart can burn fatty acids. The liver will take the fatty acids and make ketone bodies out of it. This is who we are. We're just going back to our Paleolithic period by knowing what to do and how to do it. But now we have a quantitative measure to allow us to know to do this. So it's not a mystery. So people say, oh, I'm on ketosis. How did you measure your GK? No. Well, how do you know? Well, I'm guessing. Well, no, they're not, because if you take a little, if you're in good ketosis and you take a little bit of carb, you start peeing out your ketones, you look on the strip and say, wow, look at the ketosis I'm in. And you get misinformation. It's blood. You got to do it in the blood. And once we have all these technologies at our hands, Oh yeah, we're going to drop the kid. We're never going to get rid of cancer. We're never going to get rid of chronic diseases. But at least we have the choice and the know-how now to determine whether or not I'm at risk. I've been in a risky environment, and some people don't care. There's always the guy who doesn't care, and that's what we found with our Greek study with the brain cancer. Some people said, "Well, I had radiation, chemo, and I had all this stuff, and I think that should be good enough, and I don't need to do any keto." Well, he's dead. He didn't make it. Some of those guys didn't. The ones who didn't hang on, they all died early, just like most of the people. But the guys that ate the salmon and the olive oils they lasted over 3 years. Let's give me a break. One guy's out 20 months. Pablo was out 10 years. 122 months, dying from a cerebral hemorrhage. But it shows you this works. This can work. People just need to know what to do and how to do it, and be helped by a knowledgeable physician, somebody that will give them a pat on the back and say, good going, and then we can give you a little bit of this and a little bit of that, keep you on that plane, and we can manage you and bring you out of this state of unhealth. But they're not getting that. They're being told, oh, this is nuts. No evidence to support this. So there's a lot of misinformation. And then you get all the guys that are saying, oh, this supplement, that supplement, oh, do this and do that. These guys don't know anything. They're not the ones in the lab. I know I'm not against supplements that have no function, because it makes you feel good. It's a placebo thing. But some of these supplements can actually make a bad situation worse by some guy saying something. I don't want to go through like what supplement is good and what's not good. But these guys are charlatans, quacks. But on the other hand, you take a sick person and irradiate it and poison them. I mean, that's also quackery in my mind. It's just substantiated by the system. This is it's. I mean, in 100 years, we're going to look back and say, "What the hell did we do to these poor people? Why did we brutalize them like this? Didn't we know that you could get the job done without having to do this?" But it's going to take a while for the system to adjust and the people to understand. And we just keep publishing the papers, and more trials will come out, and GKRs will be used, and people will know what to do and how to do it. It's just that simple. Well, I don't want to say cause cancer. I want to say put you at risk for mitochondrial dysfunction. That's the key. What causes cancer? Mitochondrial oxphos insufficiency coupled to a substrate level phosphorylation. Whether you get that from a viral infection, from radiation, from poor sleep, from carcinogens, all of those things. Now, if you have cancer and you eat foods that are loaded with highly processed carbs, you're going to make the cancer cells are going to love it. They're going to grow faster. We did one of the first studies in mice where we showed that you could actually accelerate or reduce the speed of dysregulated cell growth, directly measuring blood sugar. So the higher the sugar, the faster the cancer cells grow. And this now has been shown for colon, breast cancer humans. You want to get your cancer to grow fast, you got to get your blood sugar up. You really have to work hard. Now, if that means you eat pizzas and donuts every night and chocolate bars and ice cream, whatever has the highest level of highly processed carbs will make your cancer grow fast. And this has already been shown in the clinic. Those folks that have higher blood sugar levels don't live as long as the people who have lower blood sugars. So we know that reducing your blood sugar, and doesn't make any sense because some of these cancer patients they have fatigue, nausea, vomiting, diarrhea. They're losing weight because they've been poisoned and irradiated. So we call that pathological weight loss. So in order to gain the weight, they give you Ensure and donuts and pizzas and they give you all this. This is nuts. This is nuts. What are these people doing? Oh, we have to keep the weight on. Well, why did he lose weight? Oh, because we poisoned the guy. Well, who doesn't lose weight when you're poisoned? Go and take some of the chemo. You want to lose weight? Take chemo. Vomiting, diarrhea, fatigue, nausea. You can't gain weight when you have this kind of a feeling. So we're going to give you now sugary diet foods to gain your weight back. This is nuts. This is crazy, man. This is like nuts. People will come to know in the years. They say, whoa, man, who are the crazy people doing this stuff? So all we have to do is target the glucose and glutamine and transition the body to nutritional ketosis. And you can hammer these tumor cells without going bald, without having your gums bleeding, without sitting on the toilet all day long, without can't get out of bed because you feel so bad. You don't have to have any of this stuff. Yeah, well, I don't know about that. They always say, colon cancer, colon cancer. We got to have colonoscopies and all this stuff. Colon cancer is increasing all the time, even if you have colonoscopy. I don't know what's going on with that stuff. All I know is it's really hard to get cancer if you have a low GKI. So and if you are detected to have cancer, uh, I'm not telling I'm not a physician. I can't tell anybody what to do or what not to do. All I can do is share the scientific information with them. But I would never use a biopsy or any of this stuff because you run the risk of spreading the tumor cells around the body. I would like to know what non-invasive imaging technology could you use to say you have a lesion that looks like it could be cancer, but we can't know until we do a biopsy. Well, let's just assume it is without doing the biopsy, and let's just hammer the hell out of it using metabolic therapy and then see what happens to it. Okay. Oh, wow, it shrunk. In some cases, it might go away. Well, why would you stick something that's no longer there? And then if it doesn't go away, well, why don't we consider a surgical procedure to see if we can just get rid of it? Or a dose of radiation in an area of the body which is very hard to surgically get to, but it's now shrunken. It's not the same as it was when it was first detected. Now, we may be able to use radiation as a curative procedure, surgery as a curative procedure, and we may not need to use much chemo. And if we had to use chemo, we might use just a tiny bit of it just to see if we can kill a few cells off. Or immunotherapy after the tumor is shrunk and there's only a few we might come in with a small dose of immunotherapy. So again, we have all the tools needed right now to manage cancer effectively if we know how to use them in terms of what the nature of the biology of the problem is. And that's what we do. So yeah, this is going to happen. I have no doubt about it. You know why? It works. Well, this is the great tragedy right now. We know what to do and we know how to do it, but the patient themselves can't be the only participant. Metabolic therapy requires a tremendous input and activity on the part of the patient. Some patients don't even want to be bothered, and it requires some level of scientific literacy if you want to survive. And neither the physicians nor the patients have the scientific literacy to work together as a team. You have to have the caregivers. They must be knowledgeable and understand the science that we are producing, and we have written very comprehensive treatment protocols for physicians to become educated to help their patients. But the patient must also be knowledgeable. So I don't know. I never had well, then you put your soul, your existence at risk. You better wise up quick. Otherwise, you're going to be part of the planet. So you have to, if those people are motivated enough to want to know about this stuff, but they need somebody to help explain this to them. The physician, if the physician thinks cancer is a genetic disease, he's not the right guy to be explaining this to them. So they have to be educated as well. So the hospitals, the caretakers must be educated. You go to a hospital, man, they get the worst kind of food there. They give into these poor people. It's just terrible, right? It's just unbelievable. So, and the nutritionists are giving you Ensure and candy to make your weight gain in the hospital. It's like, what's going on? Because we've lost an understanding of who we are as a species, where we came from, where did our biology come from? How did we evolve? How did we become who we are today? And it all goes back to biochemistry, evolutionary biology, and then we can manage these diseases. We shouldn't allow ignorance to stand in our way because we can do it. And people just have to be shown what to do and how to do it. And that's what's going to happen. But you have to realize that as an impulsive species, we can sometimes overdo things and put ourselves at risk, going overboard on some of these things, thereby throwing you out of a healthy zone, thinking you're doing good when you're not, or pounding down a supplement that somebody told you is good and it's not working. So again, you need knowledgeable caregivers that will tell you, no, don't do that. Stay on this, because right now it's like the Wild West. Oh, this guy, he said to eat dried toads, and this guy over here said to drink goat's urine. And oh yeah, I'm going to drink goat's urine now. Get rid of it's true. I have papers showing this stuff. Yeah, People have no scientific literacy. A lot of them are functionally illiterate. You've got to work with the masses to help educate them, and the physicians that are treating them. But they should be trained in medical schools to know this. And when they go to the no, they're told it's a genetic disease. Well, we used in the mice, we found it's triglycerides is the key. You're not 400 pounds, your eyes squeezed shut, with a GKI of 500. You need a wheelchair to get around. You're not unhealthy. Okay, the guy sitting in the wheelchair at 45 years old, weighing 400 pounds, with a GKI of 600. Now he's not healthy, but that's what we're seeing all over the world. We're starting to see this, and then they pound them full of pills. Take this and then rather than, and now we have all these weight loss things. What is it? Opdivo, Jardiance, and all this, and nobody knows what the hell's going to happen to people taking that stuff for 12 or 14 years. All of a sudden, your body is completely different. Get off the pills, and all of a sudden, everything explodes back at you again. But that's the quick and easy way. That's who we are as well. We don't want any inconvenience or discomfort. We just want a quick fix, a pill. I take this pill. So I said with ketogenic metabolic therapy, take this pill with a cup of water twice a day, and that's all you take. This tiny little pill with a cup of water for 3 weeks, no food. All of a sudden, wow, that pill really works, doesn't it? But the sad thing is we have to sacrifice all these poor folks. In the United States, is 1,700 a day, 70 an hour, dying from cancer. So that's the tragedy. It doesn't have to be this way. Until the system changes, we're not going to make any major advances. So people should know that. And once they realize it's a mitochondrial metabolic disease, we're going to drop the death rate precipitously, quite effectively. And it might take 5 or 7 years or something like this, but it'll happen. No question about it.